I really want to thank you for everything you've done for chiropractic and for functional medicine and for the entire holistic industry. I wrote the book on inflammation. It's called the Skolnikoff Method, New Medicine for a New You. It's actually a whole handbook on it. So I'm a little dizzy right now hearing all these things about inflammation, about the gut and the microbiome. And
you know well.
Yeah, exactly. So, I mean, I know we've been talking about it already, but what can you share that hasn't already been said about why you think inflammation has been such a scourge on America? I mean, maybe just repeating even some of the things you've already said.
The thing about inflammation is we didn't really have a reason to measure it because no one acknowledged how powerful it was. And then when you do measure it, you have pretty crude tools, right? C-reactive protein, you can get some of the interleukin numbers, and but you sort of know sometimes that the person's inflamed. You can see it in their skin, they have intestinal issues, the chronic pain gets more chronic.
Liver spots?
Liver spots. Right. There are many examples that historically were recognized as problematic. But
yellow hands?
Yellow hands, especially if you've got liver issues. But there's also spooning of the nails. There's a whole bunch of things that are visual. The color of the iris. In Chinese medicine, they look at the tongue, which is one of the main reasons that they diagnose inflammation in traditional Chinese medicine differently. A lot of these traditional medical approaches looked at inflammation because it's a binary thing.
Yeah.
At least it would be described that way, but it's really a spectrum, right? You're really bad and everyone can see it, or you have none and you feel like $100. But this is a bigger story, I think, which is that most Americans are living at 50th percentile of who they can be. They can be much better. They just don't even think about it.
Yeah.
And often what's holding them back is chronic inflammation. And that's what chronic COVID, I think, is also revealing. Lyme disease, there are many conditions of that nature. And the battles we wage around those are important because if you ignore those are real, then you're ignoring the chronic inflammatory conditions because you're pretending they're not important, and they are important.
Sure. So what do you think we can do as a country? In my office, we use herbs, homeopathy, nutrition, flower essences, vibrational medicine. But we're not in my office right now. So what can we do as a country to fight this or prevent this inflammation?
Well, the first tool is diagnosis, right? You have to know that you don't feel as well as you could feel.
You know what I'm saying?
Yeah, I did. But that's, most people, again, you walk outside this room, the average person walking down the street with poor posture and they're sort of obviously limping a little bit. There's a lot of visual representations that people just are willing to tolerate it. You're willing to accept an average life, and you should be more demanding for yourself. And inflammation is one of the leading reasons you're just tolerating it, but we can do better.
Thank you for everything.